like to call to order the Public Health and Community Service Committee meeting on April 27, 2023 at 8:33 a.m. Kathy, can I get a roll call, please?
Hendricks. Ness.
Yes.
Jordan.
Here.
Onhoff.
Present.
Wagner. Altoff. Here. Von Bergen.
Here. Can I get a motion to let Pam into the meeting remotely?
Second.
Shorten and Van Hunt. All in favor? Aye. Okay, so next we have the minutes approval for Public Health and Community Service Committee meeting, March 30, 2023. Motion by Ms. Ness, second by Van Hoff. All in favor?
Aye.
Aye. All opposed? Motion passed. Okay. Let me get my agenda here. Do we have any public comments?
No public comments.
No public comments. Okay, we'll move on to member comments. Any member comments?
Yes.
Yes, okay.
So I spoke with Warp Corps about the viability of the street outreach project actually being able to happen with less money. Because what the commission did is when you gave them the allocation, you actually allocated them close to $40,000 less than this fiscal year, which puts that project in jeopardy. And while they're working to see if they can fit under the mental health board, which is going to be a big stretch for them, there's a very good chance that because of being underfunded, that project will not go forward. They are the only group that serves unhoused people in the county. Pioneer does not serve them. So they literally do outreach to tent cities, case management, transportation, linkages. It would be a huge loss next year for the county. So my comment is that I'm not sure that the CDBG members actually got that information. I have to go back and listen to the presentations. But I would really like to see some kind of ranking on funding based on gaps or high need priorities in the county, so that those projects rise to the top of the ranking schedule, and we know that that this requires more than an average allocation. And even to either exacerbate the county went to them and asked them to do this project. It is not within the normal scope of the work that they do. And so I don't know if they can raise community dollars to make up that gap and get beyond the fiscal year. But that is my request, Chairman, that the CDBG allocations, that we take a look at how those allocations are made based on strategic need rather than trying to give everybody something and then putting a very vital program at risk. So
That's been discussed. Hans is kind of working on maybe a new ranking system and maybe tightening up the people who may be eligible to apply so that this doesn't happen. Although I will say it wasn't a scenario of we felt we had to give something to everybody. There were some groups that were not funded, and unfortunately the ask was about 3 times more than what we had.
Yeah, I get that.
So
I get that, and I appreciate the dilemma. I know that I've sat on the commission. However, this project will go away if we can't raise at least another $65,000. The project will not happen. And then come winter, those folks will be out there with no support, unless the county picks it up. It is a public health issue. So anyway, if I could ask, I would really like to review how the rankings get created for CDBG, if I could hear that, because I am connected to the continuum of care now. And I am really encouraging them also to rank their highest need. So it gives the commission some direction on how to allocate. So anyway, thank you.
Any other?
I have a couple of questions for.
Can I respond?
Oh. Pam, did you have a comment for what Lou was talking about?
I did, but can you hear me?
No,
Barely.
Okay, then you know what, never mind, I'll deal with it later. Sorry.
no, he's gonna fix you. He's gonna fix you.
Dan's fixing you.
Try again, Pam.
Can you speak?
Now?
Okay, that's
Better.
better.
That's better, yep.
Okay, Lou, I think that conversation, the only other thing I would ask is, why is it that all of a sudden the program is in jeopardy? Where did their funding go? How have they been funded? I want that information.
Well, CDBG is the sole funder of this program. Last year was the first time they funded street outreach, and they did it through the county. Prior to that, they just sort of did it without any funding. And so the increase in their request was to support some of the administrative responsibilities that go along with monitoring HUD money, and to add a second staff person because they transport people. So I know that Thresholds used to do this program, and they eliminated it because staffing was hard. It was hard to find people who would do the program.
Maybe-
So that's,
Yeah.
and they're looking at a fundraising component now. We talked about development.
I think street outreach was the first time funded in '22, is that right? Or from county money?
21.
21, okay. And we ran through it all through '22. They did not apply. They
Right, there was, the current year we're in right now, they had not applied for the CDBG funds for this current year, so what happened was the funds ran out early in the year.
they were going to run out right around the end of the calendar year. The county gave them another $25,000 to bridge them through January, February, March to get them to mental health money.
To get them to CV.
Okay.
Yes.
And then the next thing would be the grant that Lou mentioned, that's $40,000 that starts in October.
Yeah.
However, what I think Lou was saying is that once you get to October, there's not enough to run the program past that point.
Yes. And that is our dilemma coming into winter. Now, I don't know, I've looked, I got mental health funding when I was an executive director. This will be a stretch for the mental health board to fund them. It will take something. I just talked to Leo before I came here, and they cannot help them with the application, so they have to get help with this. It's a pretty complicated application, and I know Hans will be a resource to them. But I don't know, it's a stretch under their mission. They don't fund this. They'll fund case management for mental health issues. But, so all I'm saying, and I guess my point here is this is an extremely important program because it keeps the police out of the tent cities, and, Andrew keeps his eye on people when they start to decompensate. He knows it, he gets them help. How can the commission, maybe the commission didn't really know this during the presentation, and so.
It's possible, I think the way that it was conveyed was that there was a desire to increase the level of funding for their the level of staffing, excuse me, for
Yeah.
the organization, but I don't know that the soleness, that was it's not a duplicated effort, basically. There was no other organization that's doing quite that work. Live for Lally is the closest thing, and it's related more to substance abuse.
And I don't know if the commission knew that it was an underserved population, and that without this project, there will be no services. And so that's why I think the ranking could help, that it could be flagged, that this is a critical service at this point. And then because they're like a startup, then they would have time to build their fund development program and expand their administration and, you know, be more self-sustaining, but they're just dipping their toe in this world.
If I remember correctly, the question was posed to them that if they did not receive full funding, what would happen? Because that's a pretty standard question
Right.
that we do ask, you know, during allocations. And I don't think that they conveyed that the project would
said-
completely go away, but that there would be services that,
Yeah.
you know.
I don't know, I'll have to go back and listen, because Andrew said, Andrew told me that they would not be able to do the program for 40,000. I don't know. You know, people forget what they say during those things anyway. And I guess I just think that CDBG is an opportunity to look at the gap in services in the county and how can that be a part of supporting the growth of a viable organization that can sustain themselves over time. I'm certainly not saying we should fully fund everybody forever, but I think we at least have to give them some time to build their bandwidth. You know, he's a businessman, he's just got his 501c3, he runs a business, and so this is a whole nother
Yeah.
world.
It's been something they did step into 3 years ago when
Yeah.
they were needed for meeting, you know, with the pandemic and everything. I do think Pete and I have talked in the past about capacity building for them under the CDBG program with our admin, you know, funding. So that is something, it's under the realization that mental health board funding is not something that they can't write the application
Yeah.
for an organization, so the organization has to do it. We could find them some assistance with that. I believe we can do that.
So I have a question.
Okay, go ahead.
I wanted to ask before. Lou, you made a comment that Pioneer does not serve this population at all.
Not at
Would you
all.
elaborate on that?
If you don't get into the shelter, if you're not accepted for whatever reason, right? They were here, they told us, you know, you had a whatever the reason is, not everybody's a fit for congregate programs. They can't fit inside with other people. They're either have chronic sustained mental illness, they're addicted to substance, and they don't do well living in that environment. Well, Pioneer does not serve them. So if they eliminate you from the shelter, correct me if I'm wrong, that's it. Like you're cut loose. You're just cut loose. And then you go back to the tent cities behind Wendy's in Woodstock or wherever people live that can't get into Pioneers. Pioneer is not an agency whose primary mission is to serve homeless people. Am I correct about that?
It has a lot of barriers to program entry. And so it resembles more of a transitional setting than an emergency setting.
Yes.
And then the other question I have, and I asked this question before, I know it's a difficult question because we don't really have the data. How many people are we talking about? Do we have any idea how many
It
people we're talking
fluctuates,
about?
Gloria. It fluctuates. You mean living in tent cities?
Mhm.
Well, I would put it at about 25. We do our point in time count in January. This is a HUD requirement in the last 10 days of January. We got an exception to do it the 11th day before the end of January, but commonly what we try to do, the pandemic, this is where it got stymied, we try to do a summer version of it where we find far more people that are living out in the streets. It tends to be, in our community's case, they're pretty well hidden. Not like you would see in a more urban area where people would be easily identified. They're behind Wendy's on Rose Farm Road and the quarry, you know, something like that. Not as apparent, not as visible to people as you might think.
Yeah, because I think it's probably really understated, the amount that we're
Oh,
talking about
probably.
here.
Yeah. People come in and out of being housed.
Yeah.
I mean, they'll, you know, if it gets really frigidly cold, they'll find family or friends who don't feel like they can have them living in the sub-zero weather. But, you know, living rough changes your ability to live with people. And it doesn't last, and then they're kicked out as soon as the freeze thaws and they're back on the street. It's challenging. It's challenging, no doubt.
So I'm sorry, the number you said was 25?
25. When we talked to Andrew Turner, Brandon and I met with him just a few weeks ago. And again, as Lou mentioned, the number fluctuates. So starting around this time of the year, that's when the numbers start to go up. You'll see more of a fluctuation of individuals, intensity, or areas unfit for human habitation would be kind of like the hot term for it. And the number obviously would contract a bit in the winter months. Maybe family members will allow somebody to couch surf for a little while until the weather warms up and then it's back to the streets.
And the thing that happens is if you happen to be staying with a friend on the night of the point in time count, you don't get counted. And they could kick you out 2 days later and you're unhoused. You might have been unhoused for months and then housed on a couch, and then you don't count. So the count is always fluctuating depending on the circumstances of the people you're counting, which change every day. I mean, so to have we have 38 people living in unhoused conditions at 9:05 on Thursday morning is about all we could say. Because by this afternoon, it could be 30.
And when was the count done?
The count was done the 11th day before the end of the month, so I think that was January 20th.
January 20th.
Wow, I only meant to. But I think it's an important conversation about the county providing leadership, not around this unmet need, and what does a longer, more sustainable solution look like for unhoused people, which is very challenging. It's very challenging.
So we have a count was 25, and let's just say it fluctuates, so between 25 and 100?
I would say 100 would be on the higher side, no, probably 50. When we were working with the pandemic situation, I think we had as high as 76 individuals at one time that were in separate motel rooms. That was as high as it gotten, and actually that was in the summer. So they were not on the streets at that time. We had them all, not quarantined, but in separate rooms, etc. So that's as high as we had seen. In terms of the number, if they were not in those motels, they would have been out in the streets. They were not allowed in the shelter at that time.
And these are individuals that don't fit into the Pioneer side.
Right. For whatever reason.
Because mental health, drug use.
They don't want
When you had 76 in the hotels, some of them could have fit in Pioneer, but Pioneer wasn't.
Correct. They were not taking any individuals in because of the quarantine situation.
But so when the 25 people on January 20th was done, that doesn't include people in Pioneer, right?
Right, those are sheltered individuals, so it's a separate count.
Okay.
I mean, you heard their presentation when they were here. If you have a violent crime in your background, they won't take you in. That could have been 10 years ago. And in Housing First programs, that doesn't matter. In Housing First, they house you first because getting you off the street is better for you and the community at large. So these programs have demonstrated their value and success across. It's not new. It's not a new idea. But Pioneer does not have that. They don't do that.
They don't track people.
Matt, they really, in some ways, they can't because they have a congregate site. So if you have somebody that you believe you can't manage because of their behavior, you're not going to bring them in to a congregate environment. It's not good for the other people that are.
Right, I understand that, but they don't track that.
No,
That's
No,
what-
No, it's not their-
It's not their clients.
it's not in the parameters of their program.
So now, the reason I think that number is understated, because my church does Compassion for Campers, and we serve a lot more than 25 people, and really we're seeing our greatest need for serving the people that we do this time of the year when they can camp outside. So we spend a lot of money getting backpacks and, you know, food items and things that they can use to camp outside. And I gotta tell you, that number is higher than, I'm gonna check. I'm not on that committee. I will check and see what it is, but I think that that number is highly understated. And I know there are things that can happen where they get thrown off the couch of, you know, a family member of whatever, you know, so it does fluctuate, and I appreciate that.
And,
The
and
other-
I don't want to criticize Pioneer. I want to be clear about that. This is a very specialized group of people that require a different kind of intervention. They often present as non-compliant and difficult to work with, and you know, they're not people you would want on a bus. I'm just going to say that. And so having people trained to work with that very specialized population of chronically unhoused people, and perhaps Pioneer doesn't have the bandwidth to do that. I really, in some ways I understand, but I don't think that they should be left unserved.
Well, so the other thing that was mentioned before was SROs, and how Pioneer might have been able to incorporate that in the funding that we made available for them. And they did not, and I don't know if there's any plan to do so in the future. And I think that would probably serve some of these individuals that are living in tent cities, because some of the restrictions that keep them from living in congregate living would not apply when we're talking about an SRO.
And this is exactly the reason that some of our continuum of care grants have converted from group home settings to individual apartments in the community, serving the same number of individuals, but each having their own unit. Because those congregate settings, I always say, it's like the real world from MTV, right? Where you put a whole bunch of people in a group home and see what happens. It's not a great setting.
Yeah, in my house too, you know something.
You know, I worked for an organization that had 3, and you know, there would be harmony for months in one of them, and the other one was complete chaos. It takes one person, and unfortunately,
It doesn't really take much to trigger, And I always say this because I did work in Rockford with people that were long-term unhoused, and you know, there are little areas where there are little communities. I mean, we would go in and do resource check and find places for them to take showers and clean. We do, because they did not fit in the Rockford Rescue program. They didn't. And so, and you know, twice a year, the railroad would come by and plow it all down, and 2 days later, it'd be back up. So I think that as long as there were people reaching into that community, and some people did move out of it, okay? So if the worker built a relationship with someone over time, they could be that bridge to services. It takes a long time. The lack of trust in that community is very high. So we sent chaplains in rather than caseworkers. They had a better outcome with individuals. So I guess what I'm saying here, and we sort of have gone down this path, is CDBG can be a source of targeting these programs, helping them get a foot up, but also weaning them off over time as they demonstrate the ability to raise other funds in other sources. Because I don't know, can they raise $60,000 or $70,000 before October? Maybe, and then they would keep the program going. So I don't mean to, we kind of went down this path, and I apologize for that.
It fits in with down the road with the task force
It does.
housing, and you know, it's, thank you, Hans, for
Hans has
being here and
been
filling us in.
fabulous. Hans has been great in this conversation.
Thank you,
Take
we
a bow.
appreciate
Yes.
all that you
Yes.
do.
Thank you.
He's blushing under there.
It's the limber.
Okay, any other member comments? Okay, seeing none. Next on the agenda is our interview for the Board of Health. Mr. Weinstein, if you'd like to come up to the table, please. Thank you for being here.
Thank you for inviting me.
It's wonderful that we finally have an applicant to fill the dentist position on the board. So if you would like to begin telling us a little bit about yourself and your interests. After that, there may be some questions from the committee.
Well, my name is Darryn Weinstein. I am a pediatric dentist. I don't know if I can talk to the mic over here or face you.
It'll pick you up. Just
Okay,
face the camera.
so I am relatively recent, about 2.5 years living in McHenry County. My background has been in public health dentistry. I started out working at a not-for-profit clinic providing care to the underserved. I went into education, had in that role as director of clinics at University of Illinois, and then opened a dental school at Midwestern University, down in Downers Grove, and then got recruited to North Carolina for a brief bit at the University of North Carolina, where I served as associate dean and then the director of community outreach. Within these roles, I've had the opportunity to really look at public health, and I have opened multiple public health dental clinics. Good morning.
Morning.
And I have also really got involved in North Carolina in rural oral health and some of the issues that affect populations in the rural community. I think people when you're living in the city, you don't understand the huge differences and barriers that are involved in rural communities. And so I started a rural track to get dentists to recruit people from rural communities and train them in the rural communities, so that with the goal of increasing access to care. And as I said, it really has been throughout my career this idea of trying to provide care to the underserved and providing that opportunity. So that's the overall background. I guess I should throw in there that I am originally a foreigner, so I apologize for that, a Canadian, but I am a U.S. citizen now.
Do you like hockey? Do you like hockey?
You know what? I will say I'm a bad Canadian. I've only been to 4 hockey games. But one of them was the Stanley Cup final.
Oh, okay.
So,
You're forgiven.
Okay, does anybody have any questions?
Canadian and a dentist, can you give us something redeeming?
Ms. Ness?
What brought you to McHenry County?
to be honest, I was recruited by the dental office. I moved back to Illinois during the shutdown, which was fun on its own. And I had people, I put out feelers that I was looking for, positions, and they reached out to me. And so I moved to McHenry County, initially into the city of McHenry, and worked for a year. Said this is the place I want to be, and bought a house in Crystal Lake.
Great, cool. You chose the right town. I have a question. Welcome to Crystal Lake. And how long have you been in the county, did you say?
It's been about 2.5 years now.
Okay, so you talked about your experience in working with rural kind of outreach. Do you consider McHenry County to be rural?
Parts of it.
Oh, yeah.
It's really, you've got parts of it that are definitely cities, towns, and then you've got parts of it that are not.
Okay. And then just from your past experience, and I'm not sure how much of that would involve McHenry County, what do you see as the biggest issue with pediatric dental care?
Well, providers, definitely. And not just dentists, but the entire team, getting dental assistants, dental hygienists. Actually, just released this week was a report from the Academy of Pediatric Dentistry about issues in providing care and the lack of access to care. The hidden crisis, pediatric oral health in rural America.
Wow. He didn't tell me to ask that question, by the way.
But I'll add on that Lake County, next door neighbor, actually did 2 kind of open houses where they invited everybody in. Biggest day obviously being the one that they provided services to children. They can't find people to volunteer. They can't find dentists and dental hygienists anymore to volunteer to provide those services on basically a no-fee cost. So, I mean, it's hitting everything.
We saw a lot of people retire during the pandemic saying, I just don't want to deal with this.
Yeah.
And then you've got people, the new people that are coming out are like, I want to stay in the community that I'm in now. So you're seeing a lot of people that are just staying in downtown Chicagoland or the very close suburbs, but you don't see people moving out. And then getting people into dental hygiene and dental assisting is way down. It's a challenge, and part of it is, I hate to say it, but you want to be a dental assistant, or you could go work at Walmart and you're earning about the same amount.
Yeah.
And so why am I going to put myself in a risky situation where I'm dealing with bloodborne pathogens, or where I can just go and, full clothes? Now, I'm going to say, I think the environment of working in a pediatric office is fun, it's upbeat, and it's a lot better than maybe working at Walmart, but, it's an individual choice. Also, most offices, most private dentists don't offer benefits. So there's barriers and there's other barriers that are not directly related to that, too. I mean, I don't know how I probably talk for an hour on this, so maybe I should just step back and let you ask the next question.
No, thank you for answering that question. That really sheds some light for me. I know the same has been true with long-term care with providers and, like CNAs and nurses, and COVID had a lot to do with that because some of them left those industries and are not coming back. But thank you.
Any other questions?
I think we're very lucky.
We are very lucky. It's
Yeah,
been
I
quite a
think-
few years since
Yeah.
we've had a dentist
Yeah,
on
I think
board.
that-
That
that's
position has been
amazing.
vacant for quite a while. So we really appreciate you stepping forward.
I'm glad to be here. I think it's a win-win for everybody.
Well, let's talk to you in a year.
You know what, let's not make it a year. New set of eyes, new perspective. If you see something, and you just heard the conversation that they were having earlier, if you see something that we need to be aware of or we could do better, please, notify Tracy and come back and share with us.
Absolutely.
Yeah, and let's not wait a year.
Yeah.
Usually it's too big of a problem with it.
6 months. Tops.
Seriously.
Thank you so much.
Okay, well, thank you
Thank
for
you.
coming in. Next, we are going to have deliberations, so if you'd like to stick around. I am sure that's right, exactly. So, next on the agenda, deliberation and selection of up to one candidate to county board chairman for the Board of Health, which must be a dentist, with term to begin upon appointment and expire June 30th, 2024.
I was gonna say, I'm gonna second Michael, he's already.
Mr. Shorten and Ms. Althoff.
You didn't even say a word.
We knew.
Yeah.
Let's just do it, that's my motion.
Okay. All in favor?
Aye.
Opposed? Motion carries. Okay, welcome aboard.
Thank you very much.
Very much. We
And I guess I'll see you in 6
look forward
months.
to-
Yeah, thank you so much.
Okay, so next we have the routine consent agenda. Are there any items anybody would like to see removed?
6-4.
6-4. Okay.
Otherwise, I'll make a motion to approve the routine consent agenda minus 6.4.
Okay, Ms. Altough and Ms. Ness. We get a roll call, please.
Van Hoff,
Yes.
Shorten,
Yes.
Ness,
Yes.
Hendricks,
Yes.
Altough,
Yes.
Von Bergen.
Yes. Okay, so 6.4, the resolution authorizing a program coordinator position within the Department of Health.
Yeah, so I was hoping to get some clarification on funding and what the responsibilities are. As I read through the resolution, there's a lot of things cited, CDC, saying that COVID-19 disproportionately disrupted women's health care. There's discussion about screenings, American Cancer Society. It's kind of, I'm just trying to understand, A, where the funding's coming from, B, what the position is going to be fulfilling.
Thank you for
Harris, I'm
joining
the Director
us.
of Public Health Nursing. I oversee these programs. So this funding is through IBCCP and Wise Woman grants. They're two grants that we've had for some time that provide screening to women who don't have insurance or are underinsured. During the pandemic with the shutdown, nobody was getting screenings. So the routine screenings that women need they're way behind on. So this money, it's a federal pass-through. So that money comes from the CDC, comes through the state, and then distributed throughout the state to local health departments to provide these services. So we actually contract with providers throughout the county, and we're almost like a third party, like an insurance company. We create contracts with these providers. We identify these women. If they meet the qualifications, we send them to these providers that we have contracts with, and then they bill us through, as if they were billing an insurance company, and we reimburse them for those services. We have seen a marked increase in cancers or precancerous that we're having to get women on public aid then and help them get into that system so that they can get treatment for these cancers. Wise Woman is more around cardiac, because women tend to present differently with heart disease. So that program is identifying these women as well as far as the at-risk and teaching them healthy life behaviors and providing them resources there as well. So this grant, we have been informed, we're in the process of getting another 2-year period grant. Excuse me. They have said that they're going to increase McHenry County by 35% based on what they're seeing, what they anticipate coming. So we're wanting to, currently the program is oversaw by a coordinator that also sees our chronic disease programs, and that program is where our diabetic education lives, and that's growing tremendously as well. We have waiting lists for our classes. So we decided to use this partially a part of this grant funding, which will fund this position completely, is to create a new coordinator position to oversee these increased activities that we're going to see in these 2 programs, and then keep our other coordinator overseeing the diabetic program and growing that program.
So the position is fully funded by the grant?
It will be, yes.
Okay. And it's a grant that's distributed annually?
It is distributed annually, but we apply for a 2-year period.
Okay. And it's funding that we've, or that the Department of Health has received previously, but there's a 35% increase?
Yes.
And that 35% increase fully covers the cost of the position?
It'll cover the cost of the position, and then they carve out a certain percentage that has to go to client services. So yes.
And how much is the total funding with the 35% increase?
It'll be over $350,000.
250?
350.
Yes, 3.
I don't have any additional questions.
I mean, yeah, you said there's a 35% increase. What are those, what do the actual numbers look like? Like, is it like 100 to 135? Is it 1,000 to 1,350?
Well, right now, it's about a $175,000 grant. Next year, it'll be increased about 2, and then it'll be up to.
No, oh no,
People you're serving.
yeah.
Oh,
The
okay, I'm sorry.
35% increase
My apologies.
is how I understood it. anyway.
We serve, it depends, and that, again, it goes back to that, it wanes, but we can see up to probably 2,000 to 3,000, I have the numbers right in front of me, a year
2,000 to 3,000.
Mm-hmm.
Okay.
that we screen. And then there's, some of those that we have to get diagnostics on, and the diagnostics come back.
And that 2,000 to 3,000, that's including that anticipated 35% increase. Okay. And sorry, I have
Go ahead.
one more question. And so, the program coordinator position would be completely covered through the grant funding. Do we anticipate, does the grant funding fluctuate? Like in 2 years, do we anticipate at least the same amount?
After 2 years, we would have to reevaluate where we're at, and I think that's where, the CDC is collecting that data. We're pushing that data up through them.
Okay.
So usually, the year, at that 2-year point, we will be already having those discussions on what it's gonna look like for McHenry County moving forward, and we would have to make a decision at that point, if this position would be needed at that time.
And some of that grant funding you said goes to client services directly?
Yes.
Okay.
Go ahead.
So would someone who was working that did not get health benefits and who income qualified could access this program if they were underinsured or uninsured?
If they're uninsured, they qualify
Okay.
automatically.
Okay.
And what they try to do at that point then too is they will try to find them that healthcare coverage
Okay.
and help resource, do that clinical navigation with them to get them the
Great.
healthcare that they need.
Thank you for answering those questions. I neglected to get a motion earlier before discussion, so Mr. Shorten moves and Ms. Ness seconds. Thank you. So I get a roll call for that, please.
Shorten,
Yes.
Ness,
Yes.
Hendricks,
Yes.
Van Hoff,
Yes?
Altough,
Yes.
Von Bergen.
Yes. Okay, thank you. So next we have reports on McHenry County Substance Abuse Coalition.
Good morning.
Good morning.
So you guys are relatively new to probably the Drug Free Community Grant as well as the McHenry County Substance Abuse Coalition. So I'll introduce you to both very quickly. The Drug Free Community Grant is a grant that's issued by the Office of National Drug Control. For the first 7.5 years we had this grant, it was monitored by SAMHSA. It's now monitored by the CDC. It is a partnership grant. It requires a grassroots organization that focuses on substance use. So for McHenry County, that was the McHenry County Substance Abuse Coalition. And we were not a 501c3, so we partnered with the Regional Office of Education, who was our fiscal agent, and then that obviously was served by you guys because that agency was then housed here. And so that's how we served. And so I'm going to give you some highlights because my position as the program coordinator, which I've been the entire time of the grant, excuse me, I resigned from, and I'm starting a new venture myself, and so my last day was Friday, and I wanted to highlight what went on during my time with this grant before it went into new hands. So my plan today is to kind of give you an idea of who the coalition is and what was going on, kind of some key timelines then go through some activities, highlights, some data, and what the future looks like. So, McHenry County Substance Abuse Coalition actually started in 1999. It was providers at that time who saw heroin as a problem in our community, way before we saw the news media and focus on the opioid epidemic. I joined the coalition actually in 2005. At that time I was working in Woodstock School District 200 and had a drug-free community grant. And so we encouraged the county to apply for that same grant. And we did receive that. The coalition is representatives of all of the different agencies in our county. At that time, we had about 25 members, and about 8 of us were active. So it was a very small group, but it was a pretty mighty group. And so I'll tell you kind of how we grew here. So in 2013, the Regional Office of Education and the coalition wrote together and received the Drug-Free Community Grant for the county. And it is a 5-year grant when you receive it, and you can receive it twice. You cannot receive it after that. That's the terms of the grants. And we did receive it back to back, both in 2013 and 2018. About 50% of the grants ever receive both terms, and rarely do you receive it back to back. You have to show that you're both succeeding and both still have need. And I wanted to show some kind of really concerning things that were going on in between for us. So for us, medical cannabis was legalized in Illinois, which was a critical component of what was happening in our community. And we also had our overdose death peak in 2017 in our first grant year, our grant term. So those are some of the big things we were battling while we had that grant. And then in our second grant term, our 2 biggest things that we faced were the recreational cannabis being legalized, which was also a different change. And then we also had our COVID-19 lockdown. The Drug-Free Community Grant focuses on under 20. It's really a school-based grant. And so it's looking at how do we prevent, educate, and change the thought process of risk and behaviors of children so that we don't have developed substance use later in life. And so we focus a lot on our school system. The coalition as a whole, though, we look at prenatal all the way through date of death, whatever that date might be. So we serve everybody in McHenry County from that time in the womb all the way through. So we look at every aspect of substance use. I primarily have always been the only staff member. We did have some staff in and out at different times. We also partnered very strongly with our college system, primarily Aurora, but I also partnered with about 8 other colleges to take interns in at different times to support our system when we could. So we had a large educational component that we worked with. So to give you an idea of activities we did, with opioids, we developed the Way Out program, which was a police diversion program. We brought in naloxone to our community. I'll talk a little bit more about both of those. We worked with the health department to get the opioid surveillance grant, and that's been huge for us. I'll talk a little bit more about that as well. We developed community alerts. We have drug collection boxes, drug incinerators, professional training, and that really applies to our doctors. We train them on PMP, which is the prescribers. So looking at how doctors prescribe, do you check your systems the way you're supposed to so that we're not over-prescribing, under-prescribing? What other alternatives can you do to pain management? We are active in the state opioid settlement in all components right now. We have team members on every aspect of how the state is spending the opioid settlement dollars, not just how we spend our local dollars. Alcohol, we do compliance checks. We're part of the DUI court graduation support system. We do something called Fatal Vision, Project Sticker Shock, college campaigns. I could read all of these, but you guys can kind of see we're active in every kind of component that we can be. I do want to talk a little bit about what we do that's related, because I think it's important that we look at substance use outside of the realm of specifically substance use. And so trend monitoring is really critical to what we do. Right now, everybody's very focused on opioids. And really what we're seeing right now is stimulants. And so while the world is still talking about opioids, we're educating our coalition and our team to be watching about stimulants. Because in our world, what we're seeing is cocaine and meth as a huge trend. You're also hearing on the news now xylazine. Xylazine is a animal tranquilizer that is killing in our community, and we're going to see that number go up. And so being ahead of the trend and prepping our professionals and our ERs and our people so that we can be prepared to handle our users, our people who are going to come into our system better is one of the things we do very well. And that falls on our coalition, our board, our staff to be able to educate and make sure we're ahead of the curve. We also integrate with what we think are high-risk communities. You guys were talking about the homeless. We're very integrated with WorkCorps and seeing what they know. We also work with our LGBTQ. We're integrated in youth leadership, family violence, suicide. We integrate with all those components because they're our highest risk groups. And so knowing what's happening in those components in our community is important. We also engage very much with Lake County, Kane County, Cook County, Boone County, Winnebago County on a monthly basis. That's something that I stay in touch with all of their key leaders who are doing similar work to me because it goes beyond our border. You know, we don't stop. So what they're doing is important to what I'm doing, and so we cross over our information so that we know our borders are as protected as our own. So all of these activities are very critical, but I wanted to show kind of what I think are some of our highlights. So the Away Out program was huge for us. So our police diversion program encompasses all but one of our police departments in McHenry County. And the one that isn't has the sheriff's office in it, and so the sheriff's office represents that city. And any of those departments, an individual can walk in, say, I would like treatment, I would like help. They can get help through that police department, connecting with resources. Our naloxone program is so represented now that other communities are asking us how we've managed it and how we've done it. We provide free naloxone to anybody in our community. Whether you work here, whether you live here, whether you're an officer here, doesn't make a difference. You can get free naloxone. Not only can you get free naloxone, but you can get free fentanyl test strips. Fentanyl is in about 80% of our overdose deaths. We do have polysubstance is our #1 killer, and that's critical for us to understand that fentanyl isn't necessarily the killer, it's one of the substances that's killing in our systems. But naloxone reverses opioids. So whatever the substance is that's an opioid or a narcotic, naloxone can reverse that. Last month, we handed out over 600 kits of naloxone in our community. And that means it's in the hands of the people who need it, whether you're a frontline worker, whether you're a family member, whether you're a user yourself and you're carrying naloxone, that keeps our overdose deaths down. And we are probably among the leading communities in providing naloxone, and it's huge. We're on year 7 of our International Overdose Awareness event. It is on August 27th on the Woodstock Square. We also combine it now with our Ride for Recovery, which is a 75-mile motorcycle ride. Starts at Harley-Davidson, comes in on the square, right into our International Overdose. It ends with a Rev of Remembrance, which has now traveled the internet, which is fun. People really love it. And it's a huge event, and it's just a chance to honor not just those who have passed from an early death, but those who are also in recovery and celebrating those who have made the path and the journey and are strong in their recovery. It's an important thing because I think the message, because we talk about overdose death as often as we do, we don't always celebrate the recovery. And we have so many more people who have walked through recovery, and we forget that. The death is hard, but the recovery is harder in a lot of ways. Alden Hebron was a huge celebration for us. We spent the first semester with 5th, 6th, 7th, and 8th graders, educating them on every aspect of drug education. We had the state's attorney in there, we had doctors in there, we had family members in there. Every aspect that you can think of. They interviewed them, they talked to them, they did everything, and then the second semester they wrote a book and published the book. And that book is available. And it was a great experience. Those kids still talk about it. So that was a huge success for us. And then my other highlight is just community education. Outside of the years of COVID lockdown, we average about 500 presentations per year to the community, whether that's in schools, churches, professionals, public events, whatever. That's a lot of community education getting out there on subjects. So those are some of my highlights. The opioid surveillance is the other. The partnership with that health department has created us being able to respond almost in real time to what we see as concerns, where we can put alerts out when we know there's a crisis in our community, and letting people know that, hey, we're really concerned about a situation, and we remind people that we have naloxone, fentanyl, and you have research, or we have ability to get you to resources if you want to get help. And that has changed our overdose numbers significantly. So if we look at the top, here's how I know our grant has been successful over the 9.5 years I've been doing it. The blue bars is the overdose death data for the nation, coming from, I don't remember the first year on it, but it goes up to 2021. And you see it's a steady increase for the most part. The green bars next to it are our numbers. In 2021, the Illinois overdose death rate was 29 per 100,000. We averaged 14 per 100,000. 2020, the national overdose death rate for the nation was 28.3. Ours was 16.33 per 100,000. We work so hard as a community to address our crises every single day. We listen to our anecdotal. Somebody on this, Live for Lolly is an organization that works really hard on the street. Rob works very hard on the street. If they hear on the street that we're having overdoses that are being reversed by naloxone, and we hear multiple of them, we bring that back to our overdose surveillance team. Our overdose surveillance team checks our hospital ER records or our emergency response team records. And we have a conversation. We say, hey, do we need to put an alert out? Do we remind people? We stay so on top of it that other counties are asking us how we're doing it. We are a leader in this. We were a leader when we started the A Way Out program. When we started drug incineration, we bought an incinerator so that we could get more drugs out of people's med cabinets that were sitting there. We lead in a lot of things, and it's because of this grant and because our community chose to respond together and come around that conversation. That's what the grant was meant to do, bring us together. So our overdose death rates aren't the same conversation that the nation is having. And I can tell you for the last 5 years, since 2017, we are the only county in the state of Illinois who can say that they have had lower than national and state averages consistently for 5 years, only county. So I'm very proud of that. That's a lot of work for our community. The other number, since we are a drug-free and youth-based thing, is to look at what happened while we were having all that education in our community, especially with our schools, was to look at alcohol, tobacco, cannabis, and other types of alcohol and drug-related data. So this is the Illinois Youth Survey data, which is what we use with our youth in our schools. And you can look green, burgundy, blue. Green is 2018, burgundy is 2020, and blue is 2022. You can see that we have consistently lowering numbers for 30-day use. And so the kids are not using as frequently as they were. So we've had successful data reduction in our youth-based use. So where do we go in the future? So there's a split that's going to happen now. The drug-free grant is held by the Regional Office of Education, and that will end in September. I believe they have posted for my position, and they are going to continue. I'm not sure what that's going to look like, because that's kind of their own thing. They may stay with a school preventionist. The Substance Abuse Coalition is looking to develop a wellness center, which will be a kind of drop-in center with resources and all of the things that we've always offered. They're also looking at recovery coach training. And then the last thing that I want to make sure is you guys are aware of, because they'll be coming before you, there is a reserve fund that is sitting here at the county. It was a secondary fund to our drug-free grant, and that was funds that were donated at like our International Overdose Awareness Day. There would be families who knew we weren't a 501c3, but they would write us a check anyway because they wanted to see our work continue. That went into a secondary fund here. And that money is sitting here, and they'll be coming forward to ask you to release that to them. So at some point, I hope they come forward and they ask for that money. I believe it's about $6,000 to $7,000. So I wanted to make note of that because I'm the only one who knows where that money came from. Because I was the one who put it all in the accounts. But that was money that was raised at different times where families or companies wanted to support what we were doing and gave us that money directly. So we intentionally put it in a different line than the drug-free grant so that it would be clearly marked and earmarked separately. But it has gone into reserves each year. So I went through a lot, but do you have questions? And I can go back.
Let's all talk.
First of all, congratulations. Phenomenal job. Really something to be proud of. I vaguely remember us talking about recovery coach training.
Yes.
That's pretty substantial, isn't it? Don't I remember that?
Yeah, so where we've got to with recovery coach training is 15 of us completed CCAR, which is a Connecticut-based company, but it's recognized nationally as a recovery coach system. And so 15 of us completed that. 4 of us then went on to become trainers. So we'll be doing our first training June 12th in McHenry County. And so the goal is for us to provide recovery coach training in McHenry County at low to no cost. The goal is eventually no cost. And it is the first part of what you need to do, or you can do, in Illinois to be then certified. Illinois uses peer support specialist to be certified. It's a 280-hour, I believe, program. It's usually college-based. But you can use our classes to qualify under that. So what we want to do is just be able to start getting people trained to be stronger, more educated volunteers, and or they can be hired by like Live for Lolly and some other agencies to start doing outreach work. But we wanted something that was more certified, more consistent. We've had some trouble with people kind of doing their own thing, and it doesn't always serve the client the best. So we wanted something more unified.
Thank you.
So I have a question. I was just curious why you chose Alden Hebron for the program that you mentioned.
They came to us.
Okay, cool. I lived in Hebron for over 20 years, and I just wonder, it seems like it was a big success. I wonder if that could be done, at other schools.
So we did it also at Cary at the same time, so it was an interesting thing. So Kim Qualls was the teacher, or the principal at the time, when we made the decision to do it, and that was the year she switched to Cary. So she wanted to take the whole program there, and it's like, well, we've already done everything here, so we kept it there, and we did it at Cary. So we actually did it at 2 schools. It was harder to do it at a large school. That's the only thing I would say. It's definitely a program that would be designed for a small school because the interaction with like the state's attorney and stuff, when we did it in an auditorium, it lost its impact.
Right.
Yeah, smaller numbers works better. I would say it would work well with a classroom, like if you had a high school group that wanted to focus like a health class, it would work well for that. Definitely smaller numbers. We got it done in Cary Grove, it was just much harder.
Okay, thank you.
Xylazine?
Xylazine, Xyzaline, if you're looking it up.
Okay. Is that a prescription drug?
So it's a veterinarian prescribed anesthetic, and but they are getting it on the street, and it started to reemerge, I'll say, primarily during COVID on the East Coast. But it's very strong right now in Chicago. We know it's in Lake County. We had 1 death in 2020, 2 deaths in, no wait, I got that wrong. 1 death in 2020, 2 deaths in 2021, and 3 deaths last year. We believe we have 1 death already this year that it had xylazine in it.
So is this a drug that's making its way out in the public because where's it coming from? It's like opioids. Part of the problem there was overprescription. Right.
People are just getting their hands on it. It's probably people are doing it through the drug market. People wanted it, so people are getting it. It's unfortunately like every other drug in the system that if they want it, they find a way to get it. And it's now popular, so drug dealers are getting their hands on it and providing it in the city. And it's very popular. I mean, DuPage had a huge problem with it last year. And so we're gonna see it, and we're gonna see it become a bigger issue. And the problem is, they mix it with something that has fentanyl and cocaine, and we can reverse fentanyl, but we can't reverse the combination of cocaine and xylazine.
Right.
So when they have all three in, we can't reverse that. The other problem that we're seeing again, which we saw during 2017, 2018, is benzodiazepines, which depress the system, and we can't reverse that combination. Our first 3 deaths this year that were confirmed were cocaine, benzodiazepine, and fentanyl.
And you laid out on one of your slides the chart, the legalization of medical marijuana and recreational. What's your perspective on any sort of trend that made? And
So the perception of risk is what's changed the most. Perception of risk of what that means for their health concerns and everything else. The biggest thing is that if nobody perceives it as risky, the kids' use is going to change. Now, our numbers show it goes down, but I am going to say our 2022 and 2022 data is considered very tentative and sketchy, and that is because we were in hybrid and COVID, so we had very small numbers that completed those surveys. So 2024 is I'm expecting 2024 to see our numbers go way back up, and that's not significant too. We just didn't have the grant out there anymore. It's more that we're gonna have more schools participate. And I think the bigger thing is that we have THC concentrates that are coming out in the market that they're saying are hemp related, which is an FDA regulated component. Hold on just a second. I'm waiting. Go and so hemp regulated is something that they say is 0.3 or less concentrated THC. And nobody regulates that at all. And so those are being sold in convenience marts right and left. And you can see THC, you'll even see Delta 9, which is supposedly being regulated in our dispensaries in Illinois, but you'll see them for sale in convenience marts. So supposedly those are all under 0.3. Now, Illinois State Police are testing those products and finding stuff that's way over 0.3. So kids know that. And we know kids know that because they tell us about which ones they're buying because they know that they aren't. And that they get a good buzz off of them. And so there's things like Delta 8, Delta 10, Delta 12, THCO, THCP, THCV, all of these different things that are being sold in the stores that are honestly as concerning to me as whether or not they get mom and dad's dispensary pot gummy that was left on the counter. So we have conversations that need to be had that aren't being had about what's being sold in a convenience mart.
That's the bigger problem than anything else. But the perception, because cannabis has been legalized, is that anything that's cannabis, no problem, don't worry about it. And that the under-regulated or non-regulated market is across the country. It's awful. We had 5 kids, just big report in Chicago the other day, 5 in Waukegan, that purchased product from a gas station and basically overdosed and were rushed to the hospital.
And the thing is, like gas stations, if you're not Shell, right, but mom and pops or even franchised Shells, literally, I can make stuff in my basement. Daryl and Daryl can make it in their basement, drive up and go, hey, you want to buy this? And they can buy it and put it on their shelf, and nobody can stop them. So you don't even know what you're getting if you buy those items. Right. Same thing with vape shops. Vape shops are supposed to, and convenience marts are supposed to not sell under 21. But we also haven't been doing the compliance checks on that end, especially in vape shops. It's been a push that we've been trying to make now that we're back from COVID of we should be compliance checking vape shops. It's one of the things that's on my future list with the coalition was we need to be compliance checking vape shops.
I apologize. A couple of communities here in Illinois have already banned them out together and are doing more compliance checks. So that's where you're seeing it also is municipalities are now vape shops, smoke shops, anything, they're doing big stings and doing testing. And what they're discovering is, obviously, the THC, whether it's synthesized or whether it's a natural, is substantially higher than what is even allowed
So
kind of in our potency.
is there talk then of dealing with the Delta 8s and?
There is in Springfield.
There is,
it's-
so I don't know if you remember when Spice, K2, bath salts, when those were out, do you remember that conversation way back when you saw like, people were stripping and they were talking about like the mad stuff. So it's the same problem. It's chemical structure, they just changed something. And so that's what's happening in THC right now, is they're just changing the chemical structure, so they're staying ahead of whatever we do. So they're gonna have to come up with a wording that allows them to kind of capture all cannabinoid components, and they haven't figured out the right wording to capture all of them.
without harming those individual farmers who are
Yes.
farming hemp for industrial use that still have a natural THC component to it.
This is a
It's-
little bit
it's-
of the
it's a
federal
lot more
regulation is
complicated.
interfering with the ability, like, there has to, I mean, this is not the coalition saying this is Lori Crane saying this, I have to be really clear on that. This is where the feds need to kind of make a decision and make the decision to say we're gonna step in and help regulate. Because this is the interference of, because they won't make a decision, the states are trying to make decisions, and it's creating this divide that won't allow anything to align.
Actually, they've made the decision. They've given a directive and a guidance sheet that said, in any form, in any way, anything above that .03 is.
But nobody will come in to help regulate
But
it.
nobody-
So
nobody-
so
so
then
then
nobody
nobody
comes in to
distinction
regulate,
for
and then you
so
test
you're
it,
right,
and it's
of
not
course.
accurate.
Right.
That's the point, but if we can't get somebody who will come in and officially regulate it and say, we're gonna come through and test your gummies. So for example, I purchased Delta 9 gummies, I sent them to the state to see what they were. They came back at 3.4. And they were being sold as hemp-based gummies, so at under .3. So if a 18-year-old purchased those and thought they were .3 and ate them,
Right.
they were getting way over what they should have gotten. So,
So this is even happening with Delta 9. I was more concerned with the Delta 8 because
well,
that is.
and there's other substances.
Right.
Kratom
You're-
is sold right next door to Marion Central. It's big signs,
Yeah.
big signs we sell Kratom. Kratom is an opioid at certain levels and a psychotic at another. So depending on how much Kratom you use, you can have a hallucinogen or an opioid. So, and we sell that right next door to Marion Central. So there's other substances we need to be worried about that are being sold there.
So who is responsible in a municipality? Would it be the city council that should monitor those requirements is it the health department? I mean, who's responsible for, it can't be Lori Crane sends gummies to the state. Who in the structure?
So my best advice from watching different things is that there should be a legislative component that is part of your local that says we don't allow these types of things to be sold. And then monitoring becomes compliance of usually your police department. And then testing doesn't become an issue because it's just, we go in and it's on your shelf and we take it away. And then you don't even have to test it. We did that during spice and bath salt time.
And have you talked to state reps about moving legislation like that?
So I work with Illinois Prevention Network, and we have started to do some of the conversation, especially around Kratom and some others, because Kratom, specifically Illinois really needs to get on the ball because Wisconsin has banned Kratom, Indiana has banned Kratom, Ohio has just passed the bill to ban Kratom, and Kentucky has. So we're now the island that everyone's coming to buy Kratom.
So, I'm sorry, I was just searching Delta 9 gummies and I lost. Kratom is.
Kratom it's a plant-based.
Synthesized, yeah.
It's a plant, and when you smoke it at one level, or take it in at one level, it'll act like an opiate. So a lot of people, like in drug court and stuff, will use it to compensate for opioids. But if you use it at another level, it'll act like a hallucinogen. And so we sell it at the Convenient Mart, that's right over by Marion Central. We sell it all over because we're right over the border. You'll see it in almost all Convenient Marts.
And so has the legislature been responsive to looking at this?
There actually has been 4 bills
Are
in
they
the
moving
past.
now?
No, they're not.
They just
moving.
never make it through.
What's the status, Pam, do you know?
That I just left there this morning. So there's a great deal. We made substantial presentations to both the Senate and the House. It's very complicated. Laura's been doing this Laura's been doing this for a long time. It's an educational process with legislators. I think they're getting their arms around it.
Okay.
Yeah. There's people who will say it should be out there because it's an alternative to opioids, but it really, it is, yeah. So there's always the flip side to it, but the reality is that it is an abusive, addictive product. Kratom is grown in countries where if you're caught growing it, you lose your hands. I mean, the country itself that grows it recognizes it shouldn't be grown, so.
We could try something like that.
And the law enforcement part of it is difficult because it's really the state police that are the enforcement arm. So just like everything else, the local municipality could do it, but they're limited resources. There's no funds, there's no anything, and then you'd have to do a sting and then you have to send it to the state to test that product.
Yeah,
It's
that's why the
it's a
most
very
effective thing is to
convoluted-
convince your
Right.
local legislators to change what they want on the stands. And then it's easier for your police to just go in and go, you can't have this on your stand, and you just get rid of it. And it's not tested, it's not anything else. You just say, these are things that we won't let you sell in
Similar
our
process to what
community.
we did with the what was it, the cough medicine, not cough medicine.
Put it behind the
Yeah, put it
counter.
behind the counter, yeah.
Yeah, but it gets
So-
tricky because they then sell stuff as, these things are usually labeled as dietary supplements, so then you get into, can you take off dietary supplements? Or they're sold as mood enhancers, and so they're tricky in their labeling. So you gotta really pick stuff up and look at the back of it. Phenibut is another one, and so it just gets very tricky on how do you write it so that it's successful.
I just have one more question about the program that you did at Alden, Hebron, and Cary. So if a school wanted to, you said they would have to come to the Regional Board of Education?
Now they would wanna contact the Substance Abuse Coalition.
Okay.
Yeah,
And do you have, is that information on your
yes,
presentation?
yeah, and I'll make sure they have a copy of this.
Okay, if we can have a copy of that, that would be
Yeah,
great.
yeah, you would reach out, and we have the website too. You can just go to the Substance Abuse Coalition's website, and you can link directly to their email.
And removing the product is intervention. The question is prevention. How, in any free market, you dry up, the consumer no longer buys the product dies on the market. And so prevention
Which is why we need to educate differently in our school. I mean, I have a personal belief that we start prevention too late.
All right.
My dream is that you start prevention in kindergarten. It's hard to sell that conversation to schools because the idea that you start a conversation on drug and substance use in kindergarten is very difficult. But there is ways to do it, and there's school systems that do it and have a huge effect. But it's just a hard sell to schools who are have minimal time.
Yeah, but there isn't an appetite in the community for informing children through the educational process about a number of things that would be in their best interest to explore and choose no.
I think everybody thinks you have to have a conversation about drugs and substances to make it an education program, and it's not that. It's skill sets and it's other things, so.
There's a way to do it without
By the time you get to high
specifying
school,
exactly what you're talking
a
about.
lot of them are
Exactly.
already.
Oh,
detailed.
it's so
Detail.
gone. I would say if you're starting drug education later than 4th grade, you're too late.
I agree.
Okay.
Well-
Vaping, I have schools who call me about vaping suspensions as early as 3rd grade now.
Wow.
Vaping
Kids are
suspensions in 3rd
sophisticated.
grade I had calls on that for the last 4 years. What do I do with a kid who's in 3rd grade and brought the vape to school and was sharing with friends? In 3rd grade. So the conversations have to be earlier, especially because of vaping. Vaping changed the world.
And there's a way to have them with younger children
Absolutely.
that work very, very well. But like Tracy, exactly. I mean, it has to be prescriptive, it has to be, you know, and so we are adverse to that in this environment, telling children the truth about stuff and then letting children discern and learn to choose better for themselves so that when that opportunity is presented, children can fully say no or tell their parents or tell a teacher. And that's hard work.
It's an education of
That's
parents.
really hard
Well,
work.
just teaching, if you see something, say something. That age group gets that.
Thank you.
Okay.
Thank you very
Well,
much.
thank you for
Thank you
coming
very
in.
much.
We certainly appreciate all the work that you've done
Thank you.
here, and we will miss you. Okay. So, under old business, first we have a discussion on Lead Safe Homes program. Should Scott do description old business? Okay.
Unless you want, I mean, yeah, that'd be great.
Just a statement.
These guys are giving me quick.
Yeah.
Okay, we'll be good. Yep, the purpose of being here actually isn't as much of an update, I would say, as it is coming to our standing committee because we would like to seek a renewal term on the Lead Safe Homes Program grant opportunity with the United States Department of Housing and Urban Development. And I apologize for the record, my name is Hans Ma, Community Development Administrator, and with me today is Tony Peschke. who is our Lead Safe
What is your
Homes.
name?
Tony Peschke?
And his grandmother was on the plaque downstairs for the dedication of the building, so she was a former county board member. We're coming to the committee to seek the permission to apply for this program. It would be a 4-year grant. We would not be adding any new staff. We would use existing staff of community development in coordination with Habitat for Humanity as a subrecipient for contract work. And obviously with contractors who specialize in lead remediation, lead paint remediation, I should say. So purpose of the grant is to work in households with children under the age of 6 with lead-based paint present in the home. Roughly 40% of the housing units, it's about 39% actually, according to our Illinois report, have lead-based paint or from 1978 or earlier, which is when lead-based paint was primarily in use from the 40s to the 70s. So this grant allows for us to go and remediate these hazards to allow for a safe environment for children under age 6.
How much money are you asking for, and how successful was the program? How much money did you have? How did it work? And then what are you asking for moving forward?
So our program started like at the beginning of 2020, and so we were not allowed to go into housing units for about 2 years. With staff turnover and Tony's now in the program, so we had some challenges with administrative program as far as getting units online, which we're working to, finish out our current grant. We did speak with our HUD rep, and discussed our options as far as applying. So it's not taken into consideration for 2019 and earlier grants, which is where I'm asked from. As far as, I'm sorry, what was the other part of the question?
How much money? And obviously, you just told me how effective it was. We bumped into COVID. But how much are we asking for, and what do you anticipate the outcome of that?
Okay, 1.75 million is
Okay.
going to be our request. It's lead base paint removal and Healthy Homes initiative.
Mhm.
Healthy Homes is going to be more things like radon, mold,
Okay.
insecticides, et cetera, to remove other types of hazards from homes. So the program would serve 40 households as well.
How many households?
40.
And how do you become aware of those households?
So within the report that we got from the state of Illinois here, it identifies how many units of housing that we have with those issues. That we're potentially having those issues. If they've renovated, they may not have those issues anymore. But within this report, it also identified in cases in which children were tested. Previously, we identified like 105 children with high levels of lead in their system. Now it's 156 according to the most recent report from the state just for our county, and then just the children that were tested for lead. So that's a big hazard. Down the line, those individuals will need significant supports and mental health services, provided that, that is not remediated and they're not in a safe environment. I will say, this program's been in some iteration around for a while. As a kid, I went to Chicago Public Schools, and I remember getting a flyer with the flake on it, it was like this big scary monster, and the idea of that was to go home and if you had, your younger brother and sisters, I'm the youngest child, so we didn't have any, but, that those hazards were present in a lot of homes, and so it was a program that was obviously something they've identified as an issue for some time. Even though I'm only 29 years old, it was, it's definitely a memory.
So now, you did say earlier that approximately 40% of homes in the county have some kind of lead-based paint.
They're from prior to 1978, so there's the propensity for having a lead-based paint.
So when you're talking about only serving 40 households, that doesn't really help a lot of people, right? Are you just looking at the most severe needs?
It would be, definitely the prioritization would be if you have an identified case. Now, this program could have participants that, with just identified pain in the household with the children under the age of 6. They may or may not have tested for it, but there's the potential that they could be, that's something unfortunately that happens to those individuals. And so we have our average set at around 27,000 per household. Some of them could, we've been encouraged by HUD to not overestimate how many housing units we can do because, with construction or remediation costs, it would be hard for us to say how much things are going to be. Supply chain issues certainly had been an issue, with getting supplies and things we need. So that's a very, very conservative estimate. We don't.
Have you hired a plumber recently?
Yeah.
I think
Even
I
with
went
an
into the
access to
wrong
one.
field.
Yes, it still takes time.
And this may go beyond your scope, but I just wonder for people who would not maybe qualify because of income or that kind of thing, are there grants available that they can get on their own, to address this problem of lead poisoning?
I'm not aware of any programs that would serve beyond 80% of their median income. One of the things that we're fortunate for is that our median income is on the higher side. So 80% for like a household of 4, you're looking, closer maybe $60,000. So that, and it's, when you have that big of a household, it maybe isn't stretching as far as it used to, but it's definitely geared toward lower income.
Well, Hans, couldn't a municipality come in under CDBG and ask for assistance for low-income qualified residents who needed this kind of work done?
They could apply for CDBG and it would do exactly the same thing.
Well,
It would be
I'm saying,
limited to
like
this.
it could, there are ways
Like
to.
we got so much money in that
Oh,
pot.
hush up,
Yeah.
Pam.
I thought we were trying to narrow the.
Well, I'm just saying that sometimes when you're trying to hobble, resources together for people who don't have resources, sometimes, I mean, not always, but it is a challenge.
But
It is.
I would anticipate this program has been out there for a while. I would anticipate it'll be something that we can apply for on a regular basis so that we can chip away at the
Over
issue.
time to a couple more.
Now, would this only be for unincorporated?
No.
It would be for
countywide.
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 That's not very much money.
So do you need like a
But at least
motion or
there's
did you say
something.
concurrence or?
Yeah.
Concurrence.
It's
So yeah,
something
there's
to
nothing
start,
usually with
yeah.
these, it's just been the blessing.
Yeah.
Sign.
Well, I certainly think it's,
You're
yeah.
blessed.
We're reading a program that to do that, a little jar.
Yeah. So we don't need to, down the line of,
There's a grant that was awarded, you'll need to approve
to
it.
approve it once you get it.
We like just to give committees a heads up.
And
We are
apply.
ready to pursue.
Sure. Yeah, no, that's great, thank you.
Get up and run, you got it, you got the blessing.
Blessing, yes.
Thank
Yes.
you.
Okay, so I think under old business, if Scott could come up and just give us a quick update on the status of the process for our workforce housing task force.
Well, certainly, and I appreciate this opportunity. As you all may be very well aware, per our strategic plan amendment, the topic of workforce housing is elevated to a strategic priority for McHenry County. And under that goal in the strategic plan, it indicates as an action item to create a task force to analyze and study workforce housing needs, availability, and opportunities in the county. So now that the strategic plan is adopted, we get to move on with the work. So that work would be creating this task force and moving forward. So members Ness and Althoff have stepped forward to lead this workforce housing work group, and they are underway with developing the mission and the goals of this work group, as well as identifying an appropriate participant list consisting of both internal and external participants, so subject matter experts for our community to help in this analysis and this study. So that's being developed. There's going to be some outreach to those participants to ensure that they are willing to commit the time and help the county with this goal. And once that's solidified, the next step in the process will be to present that to our PCS Chair, Von Bergen, for her review and endorsement. And if it's okay with Chair Von Bergen, it'll go to Chair Bueller, who will formally establish this committee as an ad hoc committee of the county. And once that's set, we are rocking and rolling, we're moving forward, and the real work will begin. So the first meeting has been tentatively scheduled for the end of May. Dates to be determined, and once we develop the participant list, we're going to confirm that they're available. So that's going to be the first step, the formal step with this workforce. And what you can expect is regular or periodic updates to this committee on their work, on their efforts, what they found, and so you're going to be more or less that liaison. We anticipate the work group will last about a year, plus or minus, to get this work done. And it's a pretty big project. There's a lot of moving parts that go into it. We recognize that McHenry County can only control and influence so much of this, and that's why we have to rely on our municipal partners for their assistance and for their cooperation on this, and we'll be working with them through that process. So that's where we sit. More to come. We are looking forward to tackling this topic. I just want to say on a side note, actually, I met with our MCEDC, or McHenry County Economic Development Corporation President Jim McConaughey yesterday. In fact, unsolicited, the topic of workforce housing came out from his, with his conversation, recognizing how important it is.
Good idea, sir. Sure.
To economic development, and we need this not only just for our residents so that they have a good place to live, but our employers need this so that they have a workforce on which they can draw on and get their work done. So you see a lot of things are tying into this one topic of workforce housing. How important it is, not just from a social standpoint, but from an economic development standpoint as well.
Yeah.
So with that, I think that's where it is. I'm excited to be participating on this. If there's any questions, anybody, Mr. Austin.
I got a question. I just want to give my 2 cents in. We did meet with County Coordinator Shaylin Daigle earlier this week. We are, with the assumption that there's going to be a meeting in late May, kind of getting the task force organized and setting some preliminary goals. We're going to be introducing the topic to the planners. The municipal planners are looking to have their next planners forum on Friday, January 9th. We'll be down there to kind of talk about what this group is imagining and how our municipal partners can help us out.
So very exciting stuff.
Yes.
Thank you,
Great.
Scott. Sounds exciting.
It is
Thank you very
exciting.
much.
It is,
Thank
and I
you.
think I can only speak for myself, but I'll speak for Pam also. Scott.
I'm good with
Because who
that.
cares, right? We really see the county as a bridge to bring in this very diverse, highly skilled group of people. We're not going to build housing ourselves, but this will keep the conversation rooted. It won't disappear. My experience over the past 40 years is it comes up, it collapses. It comes up, it collapses. And we're just not going to let that happen this time. So it should be fun.
Yeah. Well, thank you, Lou and Pam, for taking the extra time to put all that together.
You're very welcome.
It is fun. It is fun.
It is fun. We're having fun.
All right, well, I don't see any more presentations, any future topics. I think we have quite a few on the list that could keep us busy for a while, so.
We're in debt to that.
And no need for executive sessions, so.
Motion to adjourn.
Motion to adjourn. Ms. Althoff and Ms. Van Hoff. All in favor?